I really hope to see us really carve a niche for us in social work education. We're a clinical school, we've got some great research going on. We need to make our mark. I think our simulation lab is a possibility for us to do that. We're going to put a lot of effort into that.
Dean Findley, thank you so much for joining us on the Loyola interview series. We're very happy to have you here today.
Thank you.
You started in July, came to Loyola from Rutgers University. What stood out to you about Loyola School of Social Work and Loyola University as a whole to you?
You know, I came as a student originally many years ago, so I'm an alum. I appreciate the Jesuit education, the real investment here in education and the mission. And when I came back 30 years later to interview, I was pleasantly surprised about how that mission is still part of the school here. And as dean, I feel as we live it, we preach it, and it's a great part of the school. That's what makes Loyola such a great place to be, separate from a state university where I was for 17 years.
So as an alum and as a former student here, what have been some of the biggest changes that you've noticed since you came back?
Great question. The campus for sure. And I lived at the Lakeshore campus, and then I would commute down here on the Red Line to the Water Tower campus. There's been some construction here, but the Lakeshore campus has exploded. And it's really much more sustainable. It's beautiful. I really enjoy going there. I sit up there sometimes. I read most of my homework sitting on the lakefront. And now we go up there for meetings, and we go early so we can enjoy the beautiful lakefront and the chapel and the library. So I really appreciate the campus feel. They try to come into the Water Tower campus and health sciences as well. But Lakeshore campus has a charm to it. I really love it.
Yes, it does. So you've been here a few months, and we're just barely into the 2024 academic year. How would you describe the academic year so far for the School of Social Work?
So far so good. Our enrollment is where we predict it to be. It has changed over time, though. Social work education has changed over time. And over the years before COVID, there was a slight decline in enrollment because not that we solved all the social problems of the world and didn't need social workers. Other disciplines were kind of coming into our territory for counseling, like nursing, marriage and family therapists, psychologists. But post-COVID, post the death of George Floyd, and then the opioid crisis, and then the immigrant issues, social work had a resurgence. So hopefully our enrollments will grow to reflect that. So I was glad to see we've got a very strong enrollment here, and it's continuing that way, especially as we expand programming.
Yeah, it's certainly a field that we need. Absolutely. Can you update us on research priorities and research programs in the School of Social Work?
That's a good question. Loyola University has a great reputation, School of Social Work, for being a good, strong clinical program. So we do train a lot of practitioners. So a lot of our research is around that practitioner education. We have a new simulation center going in. We have it constructed, and now we're outfitting with technology and furniture, things like that. So our education is going to be really focused on teaching in a simulated environment within social work, also interdisciplinarily to the other schools here at Loyola, including medical, nursing, public health, other programs like that. Our research follows really the trajectory of the faculty members. So we have work in immigration, we have work in LGBTQ, we have work in suicide prevention, child welfare, older adults. We kind of run the gamut in that.
I know we also have a couple of centers at the School of Social Work. What are some of the highlights from the centers, from the See First Center, from the CIRA Center, that you would want to share?
See First is actually a really interesting center. Again, interdisciplinary. We work with other schools. As we currently have a program looking at Afghan refugees and trying to reduce stress, working with computer science and anthropology. We're working in the community to use like Fitbits to help them reduce their stress and see how it's actually affecting their overall stress. And then the other center really focuses on migration. And that one I'm really proud of because we've got some really deep, long-standing connections with the Jesuit community around the world. We had the university from Bogota here yesterday. We're talking about an international conference that's happening next year. And they've done work in Mexico, done work in Rome, around the world, truly. And they're looking for funding for that. That's the most creative part about research. It's one thing to think of the research question, but then to find the funding to carry out the project. So we've got some great faculty members who work together with other schools and within the school to try to find that funding to carry out their work. And then they publish, and then they present nationally. So we have a big Council on Social Work Education meeting coming up in end of October. And we have about a dozen faculty members and staff who are going to be attending that meeting and presenting on the work that we're doing here.
So with any transition, I would imagine there are challenges that come along with it. What have been some of the challenges that you've encountered since you arrived at Loyola?
Just transitioning from a very large university to a program that's a little smaller, a little more manageable. I really appreciate having a faculty staff meeting where we can all be in the same room. We're still 50 plus, but then to be in the room to really problem solve and think about the direction of the school, where before I was with a faculty of 78 and staff, we could never all fit in a room, 250 of us. But this way we can work together. And the challenge is to really navigate all those great ideas to help us really create a pathway for us and figure out what do we need to be doing and what's going to help set us apart in Chicago for social work. We're number 2 in the city of really 3 main social work programs. There's 5 or 6 of us graduate programs, but our main competitors, University of Chicago, University of Illinois, but we're number 2. So I'm proud of that.
Yes, absolutely. I would imagine it would be a big change going from a very large institution to Loyola, which is not a small school by any means.
Not any means.
But when touching on being able to have all the faculty in one room, that's special, and that's something that you're able to really develop stronger relationships. So when you think about those relationships with the faculty, with the staff, what do you hope to be able to see?
I really hope to see us really carve a niche for us in social work education. We're a clinical school. We've got some great research going on. We need to make our mark. I think our simulation lab is a possibility for us to do that. We're going to be a lot of effort into that because this is the top of what we want to be doing within healthcare anyway, is teaching in this environment. And not a lot of schools have this lab. Part of that money came through efforts of Dick Durbin, senator here in Illinois, working with the Health Resource Service Administration. Between them and Loyola, it was $2 million of funding to get that seeded for us. And now that's a great place for scholarship and research to come out of that, and also training for students and community partners. So I really hope we can work together to really make that, put our flag in the place for stimulated education nationally.
Absolutely. And having the opportunity to build those relationships to faculty and staff, no doubt, trickles down to the students when they see such a strong bond amongst everyone.
Yes. And that's the other benefit for me here at Loyola is our students take classes not in our own building. It's next door, which is fine. But I'm used to them being spread across multiple campuses. This way, if I want to visit a classroom, I can. Now, the provost is interested in visiting classes to see how we educate our students. And it's possible here. We're big, but we're small. I really feel that ability to make changes. Rutgers was like moving a big barge. Here, it's a little easier to correct course and keep moving forward. And there's a lot of freedom here with the support from upper administration to take risks, to pilot programs, to see what would work best for us.
That's terrific. And in the coldest of winter months, it's easy to just walk next to the building.
Yes.
It's in the winter.
You're below on down the street.
That's right. So as you think through the rest of this year, and which is almost a full year, and into the next academic year, what are some things that you want to see, priorities, things that you get really excited about?
That's great. Thank you for that. Today was our faculty staff meeting, and I told the group that we're going to be doing a strategic planning process in the spring. I want to hear ideas, but I want alumni to also have some voice in that. Students are also part of those kinds of meetings that help us direct the future. Where do we want to go? We've got some national leaders in our social work program faculty-wise, and I need to hear voices from the field. What do we need to be doing to really help us keep that market share, but also to keep our edge in the scholarship, the grants that we need to keep moving forward? So looking forward, again, the simulation lab's important to me, but there's so many other programs that the faculty would want me to support. We got a very large endowment about a year ago to the school, so we're looking at how to really invest that to drive the school forward to help us stand out from other programs in the Chicagoland area.
In addition to supporting scholarships and programs in the School of Social Work, what would you want donors and funders to know about other ways that they could support the school?
Usually, as an alum, I know that when alumni relations comes knocking on my door, I'm assuming you want big dollars. That's not so true right now for the School of Social Work. Social work education's changed in the last couple of years where Our internships, where students put 1,000 hours into the field over 2 years for free, mostly. Students are now needing to be paid for that. Not because they want to be paid, they need to be paid because there's costs associated with gas and food and everything related to serving in those roles. So $100, if an alum can give us $100, that would go far to helping students with gas, with books, childcare. Little bits of money go a long way. And that's how social work, I really believe can help us. And if I can start leading that campaign by making some contributions and leading a campaign in that effort, we're going to start one as soon as we can get started here.
That's great. That's a great message to share. Everything matters. Every bit counts. Thank you for bringing up the simulation lab. That seems like it's going to be a real game changer for the School of Social Work. Can you go into a little bit more detail about what that will look like for students, the impact that will have on the community, the profession?
Oh, that's great. Thank you for that question. Role plays, or in an environment where a student can interact with a simulated patient or another student, they interact. This is how we teach counseling skills. And we give them a scenario. They follow that scenario. The student interacts, and then we observe them. So the new center has two-way mirrors, so we can observe them in the simulated environment. We're also using technology to support the observations, and we're going to be giving students real-time feedback about their counseling skills. We'll be bringing in other disciplines so we can work collaboratively. What's it like for a student working in a hospital environment, for example? Bring in a medical student, a nursing student, a social work student. Then you have a patient, a simulated patient. In our environment, we're going to be using trained actors in those roles of the simulated patient. And they act like you'd expect a real patient, a real client to act. And that's really giving students the opportunity to interact in a simulated environment where they're not really, it's a step away from the reality of being in the hospital. So they can learn, they can make mistakes, we can correct their actions, and they can practice over and over again until they're comfortable so that when they're with patients, they feel more confident. We see that in the nursing school where they actually have mannequins, and they have mannequins that can breathe, or you can draw blood. Well, our mannequins, our trained actors, need to be adolescents or children or parents, and we can interact with them in real time. We'll have a living room set up so we can do a family therapy session. We're going to have a child center so we can work with kids in a play therapy situation. So it's really bringing the training into a real, quote, real environment, in a safe environment that we can record transcripts and help the students learn. This opens up a whole world of research. Before I got here, I was doing research in conversation analysis of working in those scenarios. Who talks when? What do they say? How long are their sentences? What's their word choice? What prompts a question? What helps the conversation go forward? So it's a whole new world. And Loyola is probably one of the only schools of social work in our nation with the kinds of facilities for simulation that we're going to have here in Chicago.
I have to imagine that with everything that's happened in the world over the last several years, especially the pandemic and the feeling of isolation that has led to depression, other mental health issues that absolutely come to the forefront when it comes to social work. What are some ways that you hope that Loyola School of Social Work will address those issues?
Very good area to be concerned about, because mental health certainly did come to the forefront post-COVID, because there were so many things happening during that COVID time. Death of George Floyd, immigration was on the rise, opioid crisis was there, along with coming out of COVID. Suicide among adolescents was on the rise. Social workers took a toll during that time. We did a lot of online counseling, but that means, like our clients, we were in our homes as well, and we didn't have the resources that we normally would have. I did a research study actually on this very topic to see what do social workers need for support. And we need to train them. Not only do they provide self-care for themselves and others, they need to be able to communicate with their managers that they need the time off. They need more support. They need to be reaching out for supervision. It's a very important part of what we teach social work students, that no matter how long you practice, you should have someone you can talk to about the clients you work with, because you can't carry that around with you all the time. We take it in for so long, but we do need to get it out. So certainly finding a support for the therapist is important, as well as the social worker, but also within communities, within the agencies that they're working in. Part of what came out of this whole era was the focus on trauma-informed care, that we really do need to focus on not what's happening today, but what happened to that client before they got here. And make sure that we're looking more holistically at the individual and taking everything that brought them to this point and considering that and how we're working with them. We also focus therapists to make sure that we're aware of where we are at when we come into meeting with a client.
That reminds me so much of our Jesuit philosophies, and especially when I think about care personalis, or care for the whole person. So two-part question on this. When you think about care for the whole person from your faculty and staff in the School of Social Work, as the dean, how do you want to make sure, and what are your plans that your faculty and staff feel cared for and feel that they have the space to also take care of themselves? It's busy being a university professor, staff member. There's a lot of things coming at you.
Absolutely. And that was the first thing I heard when I got here. Granted, it was the summertime, it was a little quieter, but I heard about the burden of the workload, how hard the faculty were working, how unappreciated they felt. They were appreciated, but they didn't feel I don't think they were hearing it as much as I was hearing others express gratitude. So my first faculty meeting, I had our chaplain, Father Jerry, do a prayer on gratitude. And I talked to the faculty and staff around how much I appreciated all they did for me, helping me. So I'm trying to model behavior around gratitude. Again, this morning at the faculty meeting, we expressed gratitude and we celebrated the successes. We are doing an amazing amount of work in the School of Social Work, both within Chicagoland for sure, working with Chicago Public Schools, for example, hospitals with agencies, but then nationally and internationally. I want us to constantly recognize what we're doing so it makes the burden seem less burdensome. When you're being recognized, you can walk a little taller because you know you're being seen. So if I can constantly bring that more positive feeling into the school, I want to do that. I feel like I put the social in work because I really want to emphasize that we are people first.
Absolutely.
And families are important. And caring for the whole person is important. So we make sure that we have some coffee, some cookies. Those little things go a long way. And thanking people for all that they're doing and appreciating them for who they are.
That is so important. Let me know when the coffees and cookies are there. I'll probably
Come
stop
on
by. And what about for the students that will be graduating from the School of Social Work during your time here at Loyola? What do you hope that they do for others when they go out into their career field in social work? How do you hope that they will care for the whole person with the folks that they're working with?
You know, that the mission of the university does pertain to everybody within the university, including our students. And that's part of every syllabus that we put out. And we also work with the students around their own self-care, recognize that they are part of a larger community. And they really do go out and carry that forth. That's why working with alumni are so important. So many of our alumni are our field instructors out working with our students. So it's great for our students to see how our alumni give back by educating the next generation of students. And we want to recognize those alumni. We have parties, we thank them, we recognize them. But hopefully the students realize that they're carrying the mission of Loyola with them when they're out there in the field. I went to the Alpha Sigma Nu ceremony on Sunday. 142 students were inducted, and about 6 of those were our social work students. I was inducted many years ago, and I realized the pledge that we take to uphold that mission, they recite then, but really it's part of our everyday mission here, and I'm hoping that they can carry that forward as they go off into their careers.
Yeah, that's great. I'm glad you were able to attend that ceremony. One more question, and you segued very nicely into it, whether you knew it or not. So as an alum, a message to your fellow alum from Loyola, how do you hope to see them engaged?
Oh, gosh, get engaged. Come back. There's a LinkedIn group that you can join, and we put that in our alumni newsletter. Definitely would like some help around supervising our students in their internships. Fewer people who work in agencies, fewer people are able to supervise students because of the workloads that agency people are taking on. So we do need, they're faculty field advisors. You can work with students. You can serve in that supervision role even though you're not an employee of the agency. So it allows our students to go in places where there aren't social workers, but they can work in environments. For example, we have students working in libraries. I think, was a social work student doing in a library? Well, we know in libraries, older adults are there. We know sometimes homeless people end up in libraries. So our social work students are there to help provide information on housing and other resources or work with the older adults. But we need someone to help supervise those students. There aren't social workers on staff in those libraries yet. But if our students are there, it's going to put the evidence that we need social work in those environments more. So that's where alumni can help us be more creative in our placements for our students, because social workers are showing up in places where you wouldn't have thought so before. And that's how alumni can get involved.
Yeah, and through our Loyola linked mentoring platform, there's so many ways to get connected that way as well. So I do have one more question, actually, and this is not related to the School of Social Work. Favorite thing, I can only name one thing, favorite thing about being back in Chicago?
Pizza?
Pizza it is. Dean Findley, such a pleasure getting a chance to sit down and speak with you. We are so excited about everything that you will do for the school and for the university, and we wish you all the best.
Thank you so much. Thank you.